Professor Patch, thank you so much for joining us. What do we know and understand about blood clots? It seems that every 3 days there's something new that comes up with this pathogen. How long do we need to study COVID-19 to really understand what form it can take in certain patients?
Well, good morning from Baltimore. So just a little background, I guess, on what is clotting, right? The human body, actually, we have an incredible ability to try and heal ourselves. So, for instance, when you have an injury to a blood vessel, say you're cutting tomatoes and you inadvertently slip and you cut your finger. The blood vessels around that try to contract and stop losing blood. And then you have several different cells and proteins that will respond to that area and quickly try to build a clot or turn that liquid blood into solid so that you're not losing additional blood. So usually this would be helpful and protective for us. What we're seeing, though, in various types of severe illness, including some of our patients with COVID-19, is there's the potential for this system to really function in an overdrive setting. We clearly, as you mentioned, more study is needed, and this is complex, and we're learning more and more every day. But it's possible that body's immune response, including that cytokine storm and trying so desperately to heal, may be associated with this increased clotting. Additionally, when you think about very ill individuals who are immobile, they're on, in a hospital bed, on a ventilator, and are not able to move themselves, you can get pooling of the blood that can develop clots. And those clots have the risk of breaking off and floating to different areas of the body, such as the lungs, and you can get problems with your body's able to use oxygen. And we're also, unfortunately, in some cases, seeing clots to the brain, leading to stroke.
Michelle, when you look at the virus, how is it actually changing nursing? How is it changing the way that nursing is organized, some of the command centers and the first responders?
Oh, sure. So I think if you had asked us a few months ago, we may not have said that we anticipate as nurses being as ubiquitous as we are in all of the efforts for this. But for instance, we have many of our nurses who are functioning within incident command centers across Hopkins and Hopkins affiliates in order to coordinate and facilitate our combined efforts. And that is around the logistics, the operations. How do we get the supplies we need? How do we get them to the front line as quickly as possible and to the right areas? As well as nurses being there as decision makers and helping the greater team to decide when should we actually launch certain types of negative pressure units or biomode units that help to contain the virus and provide the best care for all of our patients, COVID and non-COVID alike. So it really has been a unique experience for many of us, but one that I think we are very prepared to be working so closely with our colleagues to help fight.